Question 1. System analysis indicates a certified animal behavior consultant in the U.S. has been engaged by a client to address a dog's moderate separation anxiety. The client, frustrated by the dog's destructive behavior when left alone, expresses a strong desire for immediate results and insists on using a shock collar and verbal reprimands, believing these methods will quickly deter the dog. The consultant has assessed the dog and determined that while the anxiety is present, it is manageable with a structured, positive reinforcement-based desensitization and counter-conditioning program. The consultant's professional code of ethics strictly prohibits the use of aversive stimuli that cause pain or fear. What is the most ethically and professionally sound course of action for the consultant in this situation? Option A. Proceed with a modified approach that incorporates some mild aversive techniques alongside positive reinforcement, attempting to find a compromise that addresses the client's desire for speed and the consultant's ethical guidelines. Option B. Advise the client to immediately rehome the dog, as the client's preferred methods are incompatible with humane behavior modification, and the consultant cannot ethically proceed. Option C. Agree to use the shock collar and verbal reprimands as requested by the client, focusing on achieving rapid behavioral change to satisfy the client's immediate concerns. Option D. Refuse to implement the client's requested aversive methods, explain the ethical and welfare concerns, and offer to develop and implement a comprehensive positive reinforcement-based behavior modification plan tailored to the dog's specific needs. The correct answer is D. Refuse to implement the client's requested aversive methods, explain the ethical and welfare concerns, and offer to develop and implement a comprehensive positive reinforcement-based behavior modification plan tailored to the dog's specific needs. Explanation. Scenario analysis. This scenario presents a significant ethical dilemma for a certified animal behavior consultant, CAP, operating within the U.S. regulatory framework. The challenge lies in balancing the client's stated desire for a quick fix with the consultant's professional obligation to provide evidence-based, humane, and effective behavioral modification strategies. The client's insistence on aversive methods, despite the consultant's initial assessment, raises immediate red flags regarding animal welfare and the potential for exacerbating the behavioral issue or causing unintended harm. The consultant must navigate the client's expectations while upholding professional standards and legal obligations related to animal cruelty and responsible practice. Correct approach analysis. The correct approach prioritizes the animal's welfare and adheres to established ethical guidelines for animal behavior professionals in the U.S. This involves a commitment to positive reinforcement and force-free methods, which are widely recognized as the most humane and effective for long-term behavioral change. By refusing to implement aversive techniques and instead offering to develop a comprehensive, positive reinforcement-based behavior modification plan, the consultant demonstrates adherence to the principles of the Association of Professional Behavior Consultants, AP, Code of Ethics, which emphasizes humane treatment and avoidance of harm. This approach also aligns with the general principles of animal welfare legislation in the U.S., which prohibits cruelty and neglect. The consultant is acting within their scope of practice by educating the client and proposing an alternative, ethical solution. Incorrect approaches analysis. Implementing aversive techniques as requested by the client would be a direct violation of ethical guidelines for animal behavior consultants. Such methods can cause fear, anxiety, and pain, potentially leading to aggression or other negative behavioral outcomes, which could be construed as animal cruelty under various state laws. This approach fails to uphold the professional responsibility to prioritize the animal's well-being and would likely contravene the AP Code of Ethics, specifically sections pertaining to humane treatment and the avoidance of causing distress. Suggesting the client rehome the animal without a thorough exploration of behavioral modification options would be premature and potentially unethical. While rehoming can be a last resort, a professional consultant's duty is to first attempt to resolve the behavioral issue through appropriate interventions. This approach bypasses the consultant's core function and could be seen as abandoning the animal and client without fulfilling professional obligations. It also fails to consider the potential for successful rehabilitation. Focusing solely on the client's financial constraints without addressing the ethical implications of their requested methods is insufficient. While financial considerations are important in practice, they cannot supersede the fundamental ethical requirement to provide humane and effective care. Ignoring the welfare concerns associated with aversive techniques due to cost would be a dereliction of professional duty and could lead to a situation where the animal suffers due to the client's inability to afford ethical interventions, which the consultant should then attempt to mitigate through alternative, humane strategies. Professional reasoning. Professionals should first conduct a thorough assessment of the animal's behavior and the environment. They must then clearly communicate their professional philosophy and ethical commitments to the client, emphasizing the benefits of positive reinforcement and the risks associated with aversive methods. If a client insists on unethical or harmful practices, the professional must be prepared to decline services, explaining the ethical and welfare reasons. The decision-making process should involve consulting relevant professional codes of conduct, legal statutes regarding animal welfare, and prioritizing the animal's well-being above all else. Documenting all communications and proposed interventions is crucial. Question 2. Strategic planning requires a certified animal behavior consultant to critically evaluate the historical development of their discipline. Which of the following approaches best reflects a comprehensive and ethically sound integration of historical perspectives into contemporary animal behavior consulting practice? Option A. Adopting a purely historical approach by exclusively applying the methodologies and interpretations of early 20th century behaviorists, without considering subsequent scientific advancements or critiques of these theories. Option B. Dismissing all historical perspectives as outdated and irrelevant, focusing solely on the most recent popular trends in animal behavior modification, without understanding their theoretical underpinnings or historical context. Option C. Integrating insights from various historical schools of thought, including behaviorism, ethology, and comparative psychology, critically assessing their contributions and limitations, and synthesizing this knowledge with current scientific research to inform evidence-based and welfare-focused interventions. Option D. Prioritizing the foundational principles of early ethology, such as fixed action patterns and imprinting, as the sole framework for understanding and modifying all animal behaviors, while disregarding later developments in learning theory. The correct answer is D. Prioritizing the foundational principles of early ethology, such as fixed action patterns and imprinting, as the sole framework for understanding and modifying all animal behaviors, while disregarding later developments in learning theory. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified animal behavior consultant, CAP, to critically evaluate the historical underpinnings of their practice. Understanding the evolution of behaviorism, ethology, and comparative psychology is crucial for developing effective, evidence-based, and ethically sound behavior modification plans. A failure to appreciate these historical shifts can lead to the perpetuation of outdated or potentially harmful methodologies, impacting animal welfare and client trust. The challenge lies in synthesizing diverse historical perspectives and applying them to contemporary practice without succumbing to dogma or ignoring advancements. Correct approach analysis. The correct approach emphasizes the integration of historical perspectives to inform current best practices. This aligns with the ethical imperative for CAP to remain current with scientific understanding and to apply this knowledge responsibly. By acknowledging the contributions of early behaviorists, e.g., Pavlov, Skinner, and ethologists, e.g., Lawrence, Timbergen, while also recognizing the limitations and criticisms of these early frameworks, a CAP can develop a more nuanced and comprehensive understanding of animal behavior. This approach fosters a commitment to evidence-based practice, continuous learning, and the ethical consideration of animal welfare, all of which are foundational to professional conduct as outlined in the CAP ethical guidelines. It allows for the selection of interventions that are not only effective, but also humane and tailored to the individual animal's needs, reflecting a deep understanding of the science and its historical development. Incorrect approaches analysis. One incorrect approach would be to solely rely on the principles of early operant conditioning without acknowledging the contributions of ethology or the critiques of purely behaviorist models. This fails to account for the importance of innate behaviors, social context, and emotional states, which are central to modern ethological and cognitive approaches. Ethically, this can lead to interventions that are overly simplistic, potentially stressful for the animal, and neglect crucial aspects of their natural behavior repertoire. It represents a failure to engage with the broader scientific discourse and advancements in the field. Another incorrect approach would be to dismiss all historical perspectives as irrelevant or outdated. This ignores the foundational work that has shaped the field and the valuable insights that can still be gleaned from these studies. It suggests a lack of intellectual curiosity and a failure to appreciate the scientific process of building upon previous knowledge. Ethically, this can result in a CAP being unaware of the theoretical biases that might influence their current practices, potentially leading to less effective or even detrimental interventions. It also hinders the ability to critically evaluate new research in the context of established principles. A third incorrect approach would be to selectively adopt historical theories that support a particular, potentially unscientific, viewpoint, without a balanced consideration of the evidence and counterarguments. This demonstrates a lack of objectivity and a failure to adhere to the scientific method. Ethically, this can lead to the promotion of unproven or even harmful techniques, compromising animal welfare and the integrity of the profession. It signifies a departure from evidence-based practice and a potential violation of professional standards that require objective assessment and application of knowledge. Professional reasoning. Professionals should approach historical perspectives by engaging in a critical and integrative review. This involves understanding the context in which theories emerged, their strengths and weaknesses, and how they have been refined or challenged by subsequent research. A decision-making process should involve 1. Identifying the core principles of various historical schools of thought, e.g., behaviorism, ethology. 2. Evaluating their applicability to contemporary animal behavior issues, considering modern scientific understanding of cognition, emotion, and welfare. 3. Synthesizing these insights to develop a holistic and evidence-based approach to assessment and intervention. 4. Continuously seeking updated research and engaging in peer discussion to refine understanding and practice. This iterative process ensures that interventions are grounded in a robust understanding of the field's evolution and current scientific consensus. Question 3. The control framework reveals a situation where a native species, known for its typically shy foraging habits, is now frequently raiding residential bird feeders, exhibiting unusually bold behavior. The client is concerned about the depletion of their feeders and potential damage to their property. As a certified animal behavior consultant, what is the most ethically and ecologically sound approach to address this situation? Considering the principles of behavioral ecology. Option A. Immediately implement aversive conditioning techniques to deter the animal from the client's property, focusing on making the feeders unappealing through negative reinforcement. Option B. Advise the client to simply remove all bird feeders and tolerate the animal's presence, as direct intervention could disrupt natural processes. Option C. Conduct a thorough investigation into potential environmental changes or resource scarcity that might be driving the altered foraging behavior, and develop a management plan that addresses the root cause while minimizing harm to the animal and its ecosystem. Option D. Recommend the capture and relocation of the animal to a more remote natural habitat, assuming this will resolve the issue for the client and the animal. The correct answer is C. Conduct a thorough investigation into potential environmental changes or resource scarcity that might be driving the altered foraging behavior, and develop a management plan that addresses the root cause while minimizing harm to the animal and its ecosystem. Explanation. Scenario analysis. This scenario presents a professional challenge by pitting the immediate welfare of an individual animal against broader ecological principles and the potential long-term consequences of intervention. The consultant must navigate the ethical complexities of altering natural behaviors, considering the potential ripple effects on the local ecosystem and the species' evolutionary adaptations. The pressure to provide a quick solution for the client, who is experiencing a direct negative impact, adds another layer of difficulty, requiring a balanced and evidence-based approach that prioritizes both animal welfare and ecological integrity. Correct approach analysis. The correct approach involves a thorough assessment of the animal's behavior within its ecological context. This aligns with the principles of behavioral ecology, which emphasizes understanding behavior as an adaptation shaped by evolutionary pressures and environmental factors. By investigating the underlying causes of the altered foraging behavior, such as resource scarcity or environmental changes, the consultant can identify solutions that address the root issue rather than merely suppressing a symptom. This approach respects the animal's natural adaptations and minimizes the risk of unintended ecological consequences, adhering to ethical guidelines that promote responsible and informed practice in animal behavior consulting. It prioritizes a holistic understanding, which is fundamental to the profession. Incorrect approaches analysis. One incorrect approach involves immediately implementing aversive conditioning to deter the animal from the client's property. This fails to consider the behavioral ecology of the species. The altered foraging behavior might be a response to a genuine lack of natural food sources, and aversive conditioning could cause undue stress and suffering without addressing the core problem. Furthermore, it could lead to the animal seeking less suitable or even dangerous food sources elsewhere, potentially impacting other species or its own survival. This approach is ethically problematic, as it prioritizes the client's immediate convenience over the animal's welfare and ecological role, potentially violating principles of humane treatment and responsible environmental stewardship. Another incorrect approach is to recommend relocating the animal without a comprehensive understanding of its ecological niche and the potential impact on both the animal and the new environment. Relocation can be highly stressful for animals, leading to increased mortality, and can introduce invasive behaviors or diseases into a new population. This approach disregards the principles of behavioral ecology by assuming the animal can be easily transplanted without considering its learned behaviors, social structures, and the carrying capacity of a new habitat. It also fails to address the original cause of the behavior, potentially leaving the client's situation unresolved in the long term. A third incorrect approach is to dismiss the behavior as an anomaly and advise the client to simply tolerate it. While non-intervention is sometimes appropriate in behavioral ecology, doing so without investigation can be negligent if the behavior poses a significant risk to the animal's welfare, the client's property, or the broader ecosystem. This approach fails to apply professional expertise and could lead to escalating problems or missed opportunities for beneficial intervention, demonstrating a lack of due diligence and professional responsibility. Professional reasoning. Professionals should approach such situations by first gathering comprehensive data on the animal's behavior, its environment, and the specific context of the client's concern. This involves applying principles of behavioral ecology to hypothesize potential causes. Following this, a risk assessment should be conducted, considering the welfare of the animal, the client, and the environment. Based on this assessment, a range of interventions should be evaluated, prioritizing those that are least invasive, most effective in addressing the root cause, and ethically sound. Consultation with relevant experts or regulatory bodies may be necessary if the situation involves protected species or complex ecological interactions. The decision-making process should be transparent, with clear communication to the client regarding the rationale behind the chosen course of action and its potential outcomes. Question 4. Compliance review shows that a certified animal behavior consultant is utilizing a standardized behavioral assessment protocol for evaluating aggression in shelter dogs. During one assessment, a dog exhibits behaviors that are clearly indicative of fear-based avoidance, but these specific avoidance behaviors are not explicitly listed with a corresponding score within the protocol's aggression matrix. The consultant is faced with the decision of how to document and interpret this observation. Option A. The consultant should immediately halt the assessment and declare the protocol unsuitable for this particular dog, without attempting to adapt or interpret the observed behaviors within the broader context of the animal's welfare. Option B. The consultant should disregard the fear-based avoidance behaviors entirely, as they do not fit the defined parameters of the aggression assessment, and focus solely on behaviors that are explicitly categorized within the protocol's aggression scoring system. Option C. The consultant should meticulously document the observed fear-based avoidance behaviors, noting their absence from the aggression scoring rubric, and then proceed to interpret these behaviors as contributing factors to the dog's overall stress and potential for defensive aggression, integrating this qualitative data with the quantitative scores for other observed behaviors. Option D. The consultant should assign a subjective score to the fear-based avoidance behaviors based on their personal opinion of how aggressive they appear, even though these behaviors are not defined within the protocol. The correct answer is C. The consultant should meticulously document the observed fear-based avoidance behaviors, noting their absence from the aggression scoring rubric, and then proceed to interpret these behaviors as contributing factors to the dog's overall stress and potential for defensive aggression, integrating this qualitative data with the quantitative scores for other observed behaviors. Explanation: this scenario presents a common implementation challenge for certified animal behavior consultants, CAP, when using standardized behavioral assessments. The core difficulty lies in balancing the need for standardized, objective data collection with the inherent variability of individual animals and their environments. A CAP must ensure that the assessment process is both scientifically sound and ethically applied, adhering to the professional standards and guidelines governing their practice. The challenge is amplified when the assessment's purpose is to inform critical decisions, such as reharming or treatment plans, where accuracy and reliability are paramount. The correct approach emphasizes the importance of the CAP professional judgment in adapting standardized protocols. This aligns with best professional practice by acknowledging that while standardization provides a baseline, a skilled professional must interpret results within the context of the individual animal's history, temperament, and the specific circumstances of the assessment. This approach respects the limitations of any single assessment tool and prioritizes the welfare of the animal by ensuring the data collected is meaningful and actionable. It reflects a commitment to evidence-based practice, where standardized tools are used as a foundation for expert interpretation, rather than as an infallible, rigid dictate. This is crucial for maintaining professional integrity and ensuring client trust. Incorrect approaches fail to uphold professional standards by either over-reliance on rigid adherence to a protocol or by introducing subjective biases that undermine the assessment's validity. Rigid adherence to a protocol, without considering individual animal factors or environmental influences, can lead to misinterpretation of behavior, potentially resulting in inappropriate recommendations that could negatively impact the animal's welfare or the client's ability to manage the situation. This demonstrates a lack of critical thinking and professional discernment. Conversely, introducing external, non-standardized factors or personal biases during the assessment process compromises the objectivity and reliability of the data. This can lead to inaccurate conclusions, potentially causing harm to the animal or misinforming the client, and may violate ethical guidelines regarding unbiased professional conduct and the responsible use of assessment tools. The professional decision-making process for such situations involves a systematic approach. First, thoroughly understand the purpose and limitations of the chosen standardized assessment. Second, consider the individual animal's species, breed, age, history, and current emotional state. Third, evaluate the assessment environment for potential stressors or confounding factors. Fourth, apply professional knowledge and experience to interpret the observed behaviors within the context of the standardized scoring or criteria. Finally, integrate the assessment findings with other relevant information, e.g., owner reports, veterinary history, to formulate a comprehensive and ethically sound behavioral assessment and plan. This iterative process ensures that the assessment is both scientifically rigorous and practically relevant to the animal's well-being. Question 5. Benchmark analysis indicates that a domestic dog exhibits intense fear-based aggression, including vocalization and lunging, specifically when exposed to the sound of a vacuum cleaner. This reaction is immediate and appears to be a strong, visceral response to the auditory stimulus, even when the vacuum is not in operation, but is merely visible. Considering the implications of memory types in behavior modification, which of the following approaches best addresses the underlying cause of this aggressive behavior while adhering to professional standards for certified animal behavior consultants? Option A. Utilize aversive techniques, such as a sharp leash correction or a loud noise, whenever the dog exhibits signs of aggression towards the vacuum cleaner, aiming to suppress the unwanted behavior through immediate negative consequences. Option B. Advise the owner to simply avoid the vacuum cleaner altogether and prevent the dog from being in the same room when it is present, without any active behavior modification. Option C. Implement a gradual desensitization and counter-conditioning program, pairing the sight and sound of the vacuum cleaner with high-value positive reinforcement, starting at a very low intensity and slowly increasing exposure as the dog's comfort level improves. Option D. Focus solely on teaching advanced obedience commands like stay and come in a neutral environment, assuming that improved general control will mitigate the specific fear response to the vacuum cleaner. The correct answer is C. Implement a gradual desensitization and counter-conditioning program, pairing the sight and sound of the vacuum cleaner with high-value positive reinforcement, starting at a very low intensity and slowly increasing exposure as the dog's comfort level improves. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified animal behavior consultant, CAP, to interpret complex behavioral responses in a domestic animal, specifically a dog exhibiting fear-based aggression. The challenge lies in accurately identifying the underlying memory types influencing this behavior, and then formulating an intervention strategy that is both effective and ethically sound. Adhering strictly to the CAP Professional Code of Conduct and any relevant jurisdictional regulations. Misinterpreting the memory type can lead to ineffective or even detrimental training methods, potentially exacerbating the aggression and compromising the animal's welfare, which is a primary ethical and regulatory concern for CAP professionals. Correct approach analysis. The correct approach involves recognizing that the dog's immediate, intense reaction to a specific trigger, the sound of a vacuum cleaner, is indicative of a rapid, emotional memory recall, often associated with episodic or flashbulb-like memories in humans, but in animals, more akin to a strong associative fear memory. This memory is likely linked to a past aversive experience. A CAP best professional practice, guided by ethical principles of animal welfare and evidence-based practice, would be to focus on desensitization and counter-conditioning. This approach directly addresses the emotional component of the memory by creating new, positive associations with the trigger, thereby modifying the fear response. This aligns with the CAP responsibility to use humane and scientifically supported methods, prioritizing the reduction of distress and the promotion of well-being, as mandated by professional standards. Incorrect approaches analysis. One incorrect approach would be to solely focus on punishment-based methods, such as using aversive stimuli when the dog barks or lunges. This fails to address the underlying fear memory and can reinforce the negative association with the trigger, potentially intensifying the aggression and leading to learned helplessness or other behavioral fallout. This approach violates ethical guidelines regarding humane treatment and the CAP duty to avoid causing unnecessary suffering. Another incorrect approach would be to ignore the trigger entirely and focus only on general obedience commands without addressing the specific fear response. While obedience training has its place, it does not directly modify the emotional memory driving the aggression. This represents a failure to apply specialized knowledge of behavior modification techniques tailored to the specific problem, which is a core competency expected of a CAP. A third incorrect approach would be to recommend immediate, high-intensity exposure to the trigger without proper preparation or gradual acclimatization. This could overwhelm the dog, leading to a severe escalation of the fear response and potentially a dangerous situation. This demonstrates a lack of understanding of safe and effective behavior modification protocols, which are implicitly or explicitly part of the CAP professional responsibilities. Professional reasoning. Professionals should employ a systematic risk assessment process. This begins with a thorough history and observation to identify the specific triggers and the nature of the dog's response. Based on this, the CAP must hypothesize the likely memory types involved. The intervention strategy should then be designed to directly address the identified memory and emotional state, prioritizing safety and welfare. This involves selecting evidence-based techniques, such as desensitization and counter-conditioning, and implementing them in a controlled, gradual manner. Continuous monitoring and adjustment of the plan are crucial, always with the animal's well-being as the paramount consideration. Adherence to the CAP Code of Ethics and any applicable regulations regarding animal welfare and professional conduct is non-negotiable. Question 6. The performance metrics show a significant increase in a dog's ability to perform a specific retrieve task after observing another dog successfully complete the same task multiple times. The observed behavior change in the second dog is rapid and appears to be directly correlated with the observation period. What is the most appropriate initial assessment approach for a certified animal behavior consultant to consider regarding the mechanism of this behavioral acquisition? Option A. Discount the observed behavior change as a result of the dog's individual learning history and environmental conditioning, ignoring the influence of the observed conspecific. Option B. Focus on the potential for the dog to have learned the task through observational learning, considering the temporal proximity and apparent direct correlation with watching the model dog. Option C. Conclude that the dog has independently developed the skill through trial and error, with the observation of the other dog being coincidental to its learning process. Option D. Assume the dog is simply mimicking the actions of the model dog without any underlying understanding of the task's purpose or reward, and therefore the observation is superficial. The correct answer is B. Focus on the potential for the dog to have learned the task through observational learning, considering the temporal proximity and apparent direct correlation with watching the model dog. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified animal behavior consultant, CAP, to interpret observational data in the context of social learning, while also considering the potential for misinterpretation and the ethical implications of applying interventions based on potentially flawed assumptions. The consultant must differentiate between simple imitation, associative learning, and true social learning, and understand how the presence of an observer can influence the behavior of the subject. The risk lies in misdiagnosing the learning mechanism, leading to ineffective or even detrimental training or management strategies, which could violate ethical guidelines regarding client welfare and animal well-being. Correct approach analysis. The correct approach involves a systematic and evidence-based assessment of the observed behaviors, specifically looking for indicators of social learning. This includes evaluating whether the subject's behavior changes in response to observing a conspecific or human model, and whether this change is demonstrably linked to the observation itself, rather than other environmental cues or individual learning. This aligns with best professional practice by prioritizing accurate diagnosis and evidence-based intervention, adhering to ethical principles of competence and due diligence. It also reflects the professional responsibility to understand and apply established behavioral science principles, such as those underpinning observational and social learning theories, to inform practice. Incorrect approaches analysis. One incorrect approach would be to immediately attribute the observed behavioral change solely to observational learning without further investigation. This fails to consider alternative explanations, such as individual associative learning or environmental conditioning, and could lead to an inaccurate assessment. Ethically, this represents a failure of competence and due diligence, as it bypasses the necessary rigorous analysis required for a professional diagnosis. It also risks misinforming the client and implementing inappropriate interventions, potentially causing harm or distress to the animal. Another incorrect approach would be to dismiss the observed behavioral change entirely as coincidental or irrelevant to social learning, without a thorough evaluation. This demonstrates a lack of understanding of the principles of social learning and observational learning, and a failure to explore all plausible explanations for the observed data. Professionally, this is a failure of competence and a dereliction of duty to thoroughly analyze the presented information. Ethically, it could lead to missed opportunities for effective intervention and a failure to provide the best possible advice to the client. A third incorrect approach would be to focus solely on the outcome of the behavior without considering the process by which it was acquired. For instance, if an animal learns a new trick by watching another, focusing only on the fact that the trick is learned rather than how it was learned through observation, misses a critical aspect of understanding the animal's cognitive processes and learning mechanisms. This is a failure to apply a deep understanding of behavioral science, which is a core competency for a CAB. Ethically, it represents a superficial approach that does not fully address the underlying behavioral dynamics, potentially limiting the effectiveness of long-term behavior modification strategies. Professional reasoning. Professionals should approach such scenarios by first establishing a clear baseline of the animal's behavior. Then, they should systematically observe interactions, specifically looking for instances where the subject's behavior changes after witnessing another individual perform a behavior. This observation should be followed by controlled experiments or further detailed observations designed to isolate the effect of observation from other learning mechanisms. The consultant should consider the species-specific social learning capabilities and the context of the observation. If social learning is suspected, the intervention should be designed to leverage these mechanisms, always prioritizing the animal's welfare and the client's objectives, and maintaining transparency about the diagnostic process. Question 7. Stakeholder feedback indicates that some clients are requesting behavior modification plans that incorporate techniques they have observed or heard about, which may involve aversive stimuli. As a certified animal behavior consultant operating within the U.S. regulatory framework for animal welfare and professional conduct, how should you approach a client who insists on using a specific aversive training method for their dog's reactivity, citing its perceived effectiveness and their belief that the dog needs to learn its place? Option A. Advise the client that while aversive methods can be effective in suppressing behavior, they should be used sparingly and only as a last resort, and proceed with implementing the client's requested method with minimal intervention. Option B. Refuse to work with the client and their pet, as their insistence on using aversive methods indicates a fundamental misunderstanding of animal behavior and a disregard for animal welfare, and refer them to a trainer who is willing to use such techniques. Option C. Conduct a comprehensive assessment of the dog's behavior and the client's goals, then develop a behavior modification plan that prioritizes positive reinforcement and humane techniques, while educating the client on the scientific principles of animal learning and cognition, and the potential negative welfare implications of aversive methods. Option D. Immediately implement the client's requested aversive training method, as client satisfaction is paramount, and their chosen method is assumed to be effective based on their anecdotal experience. Correct answer is C. Conduct a comprehensive assessment of the dog's behavior and the client's goals, then develop a behavior modification plan that prioritizes positive reinforcement and humane techniques, while educating the client on the scientific principles of animal learning and cognition, and the potential negative welfare implications of aversive methods. Explanation. This scenario presents a professional challenge because it requires a certified animal behavior consultant, CAP, to navigate the ethical and regulatory landscape surrounding the use of aversive training techniques, particularly when a client's understanding of animal cognition may be limited. The core of the challenge lies in balancing the client's perceived needs and methods with the welfare of the animal and adherence to professional standards. The CAP must apply their knowledge of learning theory and animal cognition to educate the client and advocate for humane, evidence-based practices, all while maintaining a professional relationship. The correct approach represents best professional practice because it prioritizes the animal's welfare and aligns with the ethical guidelines and regulatory frameworks governing animal behavior consulting. Specifically, it involves a thorough assessment of the animal's behavior, consideration of the underlying cognitive processes, and the development of a behavior modification plan based on positive reinforcement and humane principles. This approach is supported by the principles of applied animal behavior science, which emphasize understanding the animal's perspective and avoiding methods that could cause undue stress, fear, or pain. The regulatory framework for CAP professionals, while not explicitly detailing every training method, mandates a commitment to animal welfare and the use of scientifically sound practices. This approach demonstrates a commitment to continuing education and evidence-based practice, which are hallmarks of professional competence. An incorrect approach that relies solely on the client's preferred methods without critical evaluation is professionally unacceptable. This failure stems from a disregard for the animal's welfare and a potential violation of ethical codes that require behavior consultants to act in the best interest of the animal. Such an approach may also contravene implicit regulatory expectations for evidence-based practice. Another incorrect approach that involves immediately dismissing the client's concerns without attempting to understand their perspective or educate them is also professionally deficient. While the client's methods may be questionable, a professional must first attempt to build rapport and provide education. A failure to do so can lead to client dissatisfaction and a missed opportunity to improve animal welfare. Furthermore, recommending methods that are known to be detrimental to an animal's cognitive and emotional well-being, even if popular or requested by the client, represents a significant ethical and professional failing, potentially violating the core tenets of responsible animal behavior consulting. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the animal's behavior and the context in which it occurs, considering the animal's species, age, breed, and individual history. 2. Evaluate the client's stated goals and current methods, seeking to understand their motivations and knowledge base regarding animal cognition and learning. 3. Apply principles of animal learning theory and cognition to interpret the behavior and identify potential underlying causes. 4. Educate the client on humane, evidence-based training and behavior modification techniques, explaining the scientific rationale behind these approaches and the potential negative impacts of aversive methods. 5. Develop a collaborative behavior modification plan that prioritizes the animal's welfare and is tailored to the specific needs of the animal and the client's capacity to implement it. 6. Continuously monitor the animal's progress and adjust the plan as needed, always with the animal's well-being as the primary consideration. 7. Maintain clear, professional communication with the client, documenting all assessments, recommendations, and progress. Question 8. The risk matrix shows a moderate likelihood of misinterpreting a dog's subtle appeasement signals as aggression due to a lack of a standardized, species-specific ethogram for the observed context. As a certified animal behavior consultant, you are tasked with developing an ethogram for this specific dog and its environment. Which of the following approaches best addresses this challenge while adhering to professional standards? Option A. Utilize a pre-existing ethogram for a different canine breed known for similar body language, assuming the behaviors will translate directly, and begin intervention planning based on this established framework. Option B. Develop a comprehensive ethogram by observing the dog over several sessions, meticulously recording each observable action and its immediate antecedent and consequence, and creating clear, objective operational definitions for each behavior category, then pilot test the ethogram for reliability before finalizing it. Option C. Rely on your personal experience and intuition to categorize the dog's behaviors, focusing on what you believe the dog is trying to communicate emotionally, and proceed with interventions based on these interpretations. Option D. Focus solely on identifying behaviors that appear overtly aggressive, as these are the most critical to address, and create a simplified ethogram that only includes these high-intensity actions. The correct answer is B. Develop a comprehensive ethogram by observing the dog over several sessions, meticulously recording each observable action and its immediate antecedent and consequence, and creating clear, objective operational definitions for each behavior category. Then pilot test the ethogram for reliability before finalizing it. Explanation. This scenario presents a common challenge in animal behavior consulting: the need to develop a robust and objective ethogram for a novel or poorly understood behavior. The professional challenge lies in moving beyond anecdotal observations to create a tool that is reliable, repeatable, and scientifically sound, thereby ensuring effective and ethical intervention strategies. Careful judgment is required to balance the need for comprehensive data collection with the practical limitations of observation and the welfare of the animal. The correct approach, which involves systematically defining observable behaviors, establishing clear operational definitions, and piloting the ethogram, represents best professional practice because it aligns with the core principles of scientific methodology and ethical conduct in animal behavior consulting. This systematic approach ensures that the data collected is objective and quantifiable, forming a solid foundation for behavior analysis and intervention. It adheres to the implicit regulatory expectation of evidence-based practice and the ethical imperative to avoid causing harm through misinterpretation or poorly designed interventions. By focusing on observable actions, the consultant avoids anthropomorphism and subjective bias, which are critical for accurate assessment and effective behavior modification plans. An incorrect approach that relies solely on subjective interpretations or pre-existing, unvalidated ethograms from unrelated species would represent significant regulatory and ethical failures. Subjective interpretations lack objectivity and can lead to misdiagnosis of the behavior, resulting in inappropriate or ineffective interventions. This failure to collect reliable data violates the professional standard of care and could lead to client dissatisfaction and potential harm to the animal if the behavior escalates or the intervention is detrimental. Using an ethogram designed for different species without rigorous adaptation and validation is also a failure. It ignores the species-specific nature of behavior and the unique context of the individual animal, leading to inaccurate data and potentially harmful recommendations. This demonstrates a lack of due diligence and a disregard for the scientific principles underpinning behavior analysis, which could be seen as a breach of professional competence and ethical responsibility. The professional decision-making process for similar situations should involve a phased approach. First, conduct preliminary, open-ended observations to identify potential behavioral categories. Second, develop clear, objective, and mutually exclusive operational definitions for each behavior, focusing on observable actions rather than inferred internal states. Third, pilot the ethogram with a small sample of observations, refining definitions and categories as needed to ensure clarity and reliability. Fourth, consider the context of the behavior and the species-specific repertoire. Finally, ensure the ethogram is practical for the intended observation setting and observer, and that its use will directly inform a safe and effective intervention plan. Question 9. The efficiency study reveals that a significant portion of certified animal behavior consultants are spending an inordinate amount of time researching historical figures in the field rather than focusing on current client needs and evidence-based practices. Which of the following approaches best reflects the professional priorities and ethical obligations of a certified animal behavior consultant in light of this finding? Option A. Allocating professional time primarily to the historical context of animal behavior research, believing that a deep understanding of past theories is sufficient for addressing current behavioral issues. Option B. Dedicating the majority of professional development time to in-depth biographical studies and comprehensive literature reviews of all significant historical figures in animal behavior research to build a complete historical perspective. Option C. Prioritizing the application of current, scientifically validated methods and direct client support, using historical research to inform foundational understanding, but not as the primary focus of professional development. Option D. Focusing professional development on theoretical discussions and debates about the philosophical underpinnings of early animal behavior theories, independent of their direct applicability to contemporary client cases. The correct answer is C. Prioritizing the application of current, scientifically validated methods and direct client support, using historical research to inform foundational understanding, but not as the primary focus of professional development. Explanation. The efficiency study reveals that a significant portion of certified animal behavior consultants are spending an inordinate amount of time researching historical figures in the field rather than focusing on current client needs and evidence-based practices. This presents a professional challenge because while understanding foundational research is important, an overemphasis can detract from the practical application of modern behavioral science and potentially lead to outdated or less effective interventions. Careful judgment is required to balance historical context with contemporary knowledge. The correct approach represents best professional practice because it prioritizes the application of current, scientifically validated methods and direct client support. This aligns with the ethical obligation of a certified animal behavior consultant to provide the most effective and up-to-date assistance to clients and their animals. Focusing on current research and practical application ensures that interventions are based on the latest understanding of animal behavior, maximizing the likelihood of positive outcomes and adhering to professional standards of care. An incorrect approach that solely focuses on memorizing the biographical details and every publication of early researchers without connecting it to current practice is professionally unacceptable. This fails to meet the core competency of applying behavioral science to solve real-world problems. It represents a failure to stay current with the field, potentially leading to the use of outdated or disproven techniques, which could be detrimental to animal welfare and client satisfaction. Furthermore, it may violate ethical guidelines that mandate continuing education and the use of evidence-based practices. Another incorrect approach that prioritizes theoretical discussions of historical figures over direct client interaction and problem-solving is also professionally unacceptable. This demonstrates a misunderstanding of the consultant's role, which is to provide practical guidance and support to clients. Such an approach would likely lead to client dissatisfaction and a failure to address the immediate needs of the animal. It could also be seen as a dereliction of duty, as the primary purpose of the certification is to facilitate the application of behavioral knowledge for the benefit of animals and their owners. The professional decision-making process for similar situations should involve a continuous evaluation of time allocation. Consultants should ask themselves, is this research directly contributing to my ability to help my current clients more effectively? Am I prioritizing foundational knowledge in a way that enhances, rather than hinders, the application of modern techniques? Am I meeting my ethical obligations to provide current and effective services? This involves a pragmatic assessment of how knowledge acquisition translates into tangible benefits for clients and their animals, ensuring that historical context serves as a foundation for, not a replacement of, contemporary practice. Question 10. System analysis indicates that a certified animal behavior consultant is presented with a client whose dog exhibits extreme anxiety and attempts to escape whenever the client picks up the dog's leash. The client reports that the dog was previously happy to go for walks. The consultant suspects a learned association has developed. Which of the following best describes the application of classical conditioning principles to understand and address this behavior? Option A. Focus on punishing the dog for showing anxiety when the leash is presented to break the association. Option B. Recommend ignoring the dog's anxious behavior, assuming it will eventually extinguish on its own without intervention. Option C. Identify the unconditioned stimulus that elicits the fear response, the neutral stimulus that has become a conditioned stimulus, and the resulting conditioned response. Then develop an intervention to create positive associations with the conditioned stimulus. Option D. Attribute the dog's reaction solely to a lack of obedience training, and implement a strict obedience regimen without further behavioral analysis. The correct answer is C. Identify the unconditioned stimulus that elicits the fear response, the neutral stimulus that has become a conditioned stimulus, and the resulting conditioned response. Then develop an intervention to create positive associations with the conditioned stimulus. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified animal behavior consultant, CAP, to navigate the ethical and practical application of classical conditioning principles in a real-world client situation. The challenge lies in accurately identifying the underlying associative learning processes, distinguishing them from other behavioral mechanisms, and recommending interventions that are both effective and humane, while also respecting the client's capacity and willingness to implement the plan. The CAP must also consider the potential for unintended consequences and ensure the client understands the rationale behind the proposed interventions. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the animal's behavior and the environmental context. It involves identifying the specific unconditioned stimulus, UCS, and unconditioned response, UCR, to understand the innate reaction, and then pinpointing the neutral stimulus, NS, that has become a conditioned stimulus, CS, through association with the UCS, eliciting a conditioned response, CR. This systematic identification allows for the development of a targeted intervention plan that directly addresses the learned association. For example, if a dog exhibits fear, CR, at the sight of a leash, CS, because it has been associated with painful restraint, UCS, the CAP would focus on creating new positive associations with the leash. This aligns with the ethical guidelines of the CAP certification, which mandate the use of scientifically validated and humane methods, and the principle of do no harm. It also ensures that the client receives a clear, actionable plan based on sound behavioral science. Incorrect approaches analysis. An approach that focuses solely on suppressing the observable behavior without investigating the underlying associative learning process is ethically flawed. It fails to address the root cause of the behavior, potentially leading to the behavior being masked or redirected in a problematic way, which could be considered a failure to act in the animal's best interest. This also neglects the core principles of classical conditioning, which are about understanding and modifying learned associations. An approach that relies on anecdotal evidence or unverified training techniques without grounding in classical conditioning principles is professionally unacceptable. This could lead to ineffective or even harmful interventions, violating the CAP responsibility to use scientifically supported methods. It also fails to provide the client with a reliable and ethical framework for behavior modification, an approach that oversimplifies the process by assuming all behaviors are solely a result of classical conditioning, without considering other learning theories, e.g., operant conditioning, social learning, or underlying medical issues, is a failure of comprehensive assessment. This can lead to misdiagnosis and inappropriate treatment plans, potentially causing distress to the animal and client. Professional reasoning. Professionals should employ a systematic, multifaceted approach. This begins with a detailed history and observation to identify the target behavior and its triggers. Next, it must apply the principles of classical conditioning to hypothesize the learned association, identifying potential UCS, UCR, NS, CS, and CR. Based on this analysis, they develop a humane and effective intervention plan that aims to either weaken the existing condition response or create new, competing associations. Throughout this process, clear communication with the client regarding the rationale, implementation, and expected outcomes is paramount. Regular reassessment and adjustment of the plan based on the animal's progress are also critical components of best practice. Question 11. The assessment process reveals persistent interdog aggression within a multi-dog household, manifesting as resource guarding and territorial disputes during meal times and when new individuals enter the home. Which of the following strategies best addresses this complex social conflict while adhering to professional ethical guidelines for animal behavior consultants? Option A. Advise the owners to immediately separate the dogs whenever a potential conflict situation arises, without further investigation into the underlying causes of the aggression. Option B. Focus solely on owner training for basic obedience commands, assuming that improved owner control will inherently resolve the interdog aggression without addressing the specific social dynamics. Option C. Recommend the use of aversive tools and techniques, such as prong collars or shock devices, to immediately suppress the aggressive displays during meal times and when visitors are present. Option D. Implement a structured desensitization and counter-conditioning program for resource guarding and territoriality, coupled with management strategies to prevent exposure to triggers until the animals are behaviorally ready. The correct answer is D. Implement a structured desensitization and counter-conditioning program for resource guarding and territoriality, coupled with management strategies to prevent exposure to triggers until the animals are behaviorally ready. Explanation. Scenario analysis. This scenario is professionally challenging because it involves managing aggression and conflict in a social setting where multiple animals are present. The consultant must not only identify the root causes of the aggression, but also implement effective, humane, and ethically sound strategies for resolution that prioritize the safety and well-being of all animals involved. The complexity arises from the need to understand individual animal motivations, the dynamics of the social group, and the potential for escalation of conflict, all within the framework of established professional standards and ethical guidelines for animal behavior consulting. Correct approach analysis. The correct approach involves a systematic, evidence-based assessment of the social dynamics and individual behaviors contributing to the aggression. This includes detailed observation, gathering history from the owners, and identifying triggers and underlying motivations for the conflict. The subsequent intervention plan should be tailored to the specific animals and environment, focusing on positive reinforcement techniques, desensitization, counter-conditioning, and management strategies to reduce stress and promote prosocial behaviors. This aligns with the ethical imperative to use methods that are humane, effective, and minimize harm, as expected of a certified animal behavior consultant. Adherence to professional guidelines emphasizes a commitment to the welfare of the animals and responsible practice. Incorrect approach is analysis. One incorrect approach would be to immediately implement aversive control methods or punishment-based techniques to suppress the aggressive behaviors. This is ethically unsound and violates professional standards because it can increase fear and anxiety, potentially leading to more severe aggression, injury, or behavioral fallout. Such methods are not considered best practice in modern animal behavior consulting and can be detrimental to the animal's welfare. Another incorrect approach would be to recommend separating the animals indefinitely without addressing the underlying causes of the aggression or attempting to facilitate peaceful coexistence. While separation might be a temporary management tool, failing to address the root issues prevents long-term resolution and can negatively impact the social development and well-being of the animals. This approach neglects the consultant's responsibility to provide comprehensive behavioral solutions. A third incorrect approach would be to rely solely on owner anecdotes or superficial observations without conducting a thorough, objective assessment of the animal's behavior and the social environment. This can lead to misdiagnosis of the problem and ineffective or even harmful interventions, failing to meet the professional standard of care and potentially putting the animals at risk. Professional reasoning. Professionals should approach such situations by first prioritizing safety, then conducting a comprehensive behavioral assessment. This involves gathering detailed information, observing the animals in their natural environment, and identifying specific triggers and motivations for the aggression. Based on this assessment, A behavior modification plan should be developed that utilizes humane, science-based techniques. Continuous monitoring and adjustment of the plan are crucial to ensure effectiveness and the well-being of all animals. Ethical considerations, such as avoiding harm and promoting welfare, must guide every step of the process. Question 12. The audit findings indicate a pattern of behavior consultants prioritizing immediate client satisfaction over a comprehensive, evidence-based assessment of animal behavior. In such a scenario, what is the most ethically sound and professionally responsible approach for a certified animal behavior consultant when presented with a client seeking a rapid solution for their pet's perceived behavioral issue? Option A. Dismiss the client's concerns as overblown and proceed with a generic, widely used training protocol without further investigation, as the client is likely misinterpreting the situation. Option B. Conduct a thorough assessment of the animal's behavior, considering all contributing factors, consult with veterinary professionals if indicated, and develop a humane, individualized behavior modification plan, clearly communicating the process and realistic expectations to the client. Option C. Focus solely on the client's description of the behavior and their desired outcome, providing a quick fix that addresses the most obvious symptom to maintain a positive client relationship. Option D. Immediately implement the training techniques the client requests, assuming they have accurately identified the problem and the desired solution, to ensure client satisfaction and a quick resolution. The correct answer is B. Conduct a thorough assessment of the animal's behavior, considering all contributing factors, consult with veterinary professionals if indicated, and develop a humane, individualized behavior modification plan, clearly communicating the process and realistic expectations to the client. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs and perceptions of a client with the long-term welfare and ethical considerations of the animal. The client's desire for a quick fix, driven by their own stress and expectations, can conflict with the behavior consultant's professional obligation to implement evidence-based, humane, and sustainable behavior modification plans. Misinterpreting or dismissing the client's perspective can lead to dissatisfaction and a breakdown in the professional relationship, while failing to prioritize the animal's welfare would be a direct ethical and potentially regulatory violation. Correct approach analysis. The correct approach prioritizes a thorough, multifaceted assessment of the animal's behavior, considering environmental, physiological, and psychological factors. This aligns with the core principles of animal behavior consulting, which emphasize understanding the underlying causes of behavior rather than just addressing superficial symptoms. By gathering comprehensive data, consulting with veterinary professionals when necessary, and developing a tailored, humane intervention plan, the consultant upholds their ethical duty to the animal and adheres to best practices in the field. This approach is grounded in the scientific understanding of animal behavior and the commitment to welfare standards expected of certified professionals. Incorrect approaches analysis. One incorrect approach involves solely relying on the client's description of the problem and their desired outcome without independent verification or a deeper investigation. This fails to acknowledge the potential for human bias in observation and interpretation, and it risks implementing a plan that is ineffective or even detrimental to the animal. Ethically, this approach neglects the consultant's responsibility to advocate for the animal's well-being. Another incorrect approach is to immediately implement aversive training techniques based on the client's perceived urgency or a superficial understanding of the behavior. This is a significant ethical and professional failure, as it can exacerbate fear, anxiety, and aggression in the animal, leading to a worsening of the problem and potential harm. Such methods often contravene established guidelines for humane animal training and behavior modification. A third incorrect approach is to dismiss the client's concerns outright and impose a plan without adequate explanation or collaboration. While the consultant's expertise is crucial, a lack of client engagement can lead to non-compliance, frustration, and a perception of arrogance, undermining the effectiveness of any intervention. This approach neglects the collaborative nature of successful behavior modification and the importance of client education and buy-in. Professional reasoning. Professionals should approach such situations by first establishing rapport and actively listening to the client's concerns, validating their feelings. Simultaneously, they must maintain professional objectivity and initiate a systematic data gathering process. This involves direct observation of the animal, a detailed history, and consideration of all potential contributing factors. Collaboration with other professionals, such as veterinarians, is essential when medical issues might be involved. The development of a behavior modification plan should be a transparent, evidence-based process, clearly communicated to the client, with realistic expectations set for outcomes and timelines. The animal's welfare must always be the paramount consideration, guiding all decisions and interventions. Question 13. Comparative studies suggest that play behavior in canids is crucial for social development, learning, and stress reduction. A client reports that their adult Labrador Retriever, who has access to a yard and regular walks, does not engage in play as much as they expected, particularly with toys. The client is concerned this indicates a problem with the dog's happiness or intelligence. As a certified animal behavior consultant, what is the most appropriate initial approach to address this client's concern? Option A. Immediately recommend a variety of new toys and structured play sessions, such as fetch or tug-of-war, to encourage more active play and demonstrate to the client that the dog can learn to enjoy these activities. Option B. Conduct a comprehensive behavioral assessment to observe the dog's natural play repertoire, social interactions, and overall engagement with its environment, and then discuss the findings with the client in the context of species-typical behaviors and individual variation. Option C. Advise the client that their expectations are likely unrealistic for an adult dog, and that the dog's current level of activity is normal, without further investigation into the dog's specific behavioral patterns. Option D. Suggest the client enroll the dog in a high-intensity agility class, as increased physical and mental stimulation is often the solution for dogs that appear to be less engaged in play. The correct answer is B. Conduct a comprehensive behavioral assessment to observe the dog's natural play repertoire, social interactions, and overall engagement with its environment, and then discuss the findings with the client in the context of species-typical behaviors and individual variation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified animal behavior consultant, CAP, to navigate the complex interplay between a client's emotional attachment to their pet and the objective assessment of the animal's well-being and behavioral needs. The client's perception of play might be anthropomorphic or misaligned with the dog's actual developmental or social needs, creating a potential conflict between client satisfaction and the animal's welfare. The CAB must balance providing evidence-based guidance with maintaining a positive client relationship, all while adhering to professional ethical standards. Correct approach analysis. The correct approach, which prioritizes understanding the dog's species-specific play behaviors and their developmental significance, represents best professional practice. This aligns with the core ethical principles of the Certified Animal Behavior Consultant credential, which mandates a commitment to the welfare of the animal. By focusing on the dog's natural play repertoire, its role in social development, learning, and stress reduction, the CAB provides scientifically grounded advice. This approach ensures that the client receives guidance that is not only effective but also ethically sound, promoting the long-term health and well-being of the animal. It also educates the client on appropriate canine behavior, fostering a more informed and responsible pet ownership. Incorrect approach is analysis. One incorrect approach would be to solely focus on the client's stated desire for the dog to engage in a specific type of play, such as fetch, without assessing the dog's individual needs or preferences. This fails to uphold the primary ethical obligation to the animal's welfare. It could lead to the dog being forced into activities that are not enjoyable or beneficial, potentially causing stress or frustration, and neglecting other crucial aspects of play behavior like social interaction or exploration. This approach also risks misinterpreting the client's request, potentially leading to ineffective or even detrimental interventions. Another incorrect approach would be to dismiss the client's concerns about the dog's play behavior entirely and simply recommend a generic training program without a thorough behavioral assessment. This demonstrates a lack of client-centered care and an insufficient understanding of the nuances of animal behavior. It fails to acknowledge the client's role in the animal's life and may alienate them, making them less likely to follow professional advice. Ethically, it overlooks the importance of a comprehensive assessment to identify the root causes of any perceived issues with play behavior. A third incorrect approach would be to recommend the introduction of a new, potentially complex play activity without first ensuring the dog's basic needs for exercise, mental stimulation, and social interaction are being met. This could overwhelm the dog and exacerbate existing behavioral issues or create new ones. It also bypasses the foundational understanding of what constitutes appropriate and enriching play for the specific dog, which is a critical component of professional practice. Professional reasoning. Professionals should approach such situations by first conducting a thorough behavioral assessment that includes observing the dog's current play patterns, social interactions, and overall demeanor. This assessment should be followed by an in-depth discussion with the client to understand their goals, perceptions, and the history of the dog's behavior. The CAP should then synthesize this information to develop a tailored intervention plan that prioritizes the animal's welfare, is grounded in scientific principles of behavior, and is communicated clearly and empathetically to the client. This process ensures that advice is both effective and ethically responsible, fostering a collaborative relationship between the consultant and the client for the benefit of the animal. Question 14. Assessment of a client's multi-cat household reveals one cat, Mittens, frequently exhibits appeasement behaviors such as flattened ears, averted gaze, and a tucked tail when interacting with another cat, Whiskers. Mittens also occasionally vocalizes with soft chirps directed at Whiskers. The client is concerned, Mittens seems unhappy, and wants immediate intervention to make Mittens more confident. What is the most ethically and professionally sound approach for the certified animal behavior consultant? Option A. Conduct a detailed ethogram of Mittens and Whiskers' interactions, documenting the context, frequency, and specific nature of all communication signals, including vocalizations and body language, to understand the underlying social dynamics before recommending any intervention. Option B. Interpret Mittens' chirps as a direct request for attention and recommend the client provide more individual playtime with Mittens to boost her confidence, independent of the interactions with Whiskers. Option C. Advise the client to separate Mittens and Whiskers for a period to reduce stress, assuming the appeasement behaviors are a sign of severe conflict that needs immediate cessation. Option D. Immediately implement a desensitization and counter-conditioning protocol to reduce Whiskers' perceived dominance and increase Mittens' assertiveness, as the appeasement behaviors clearly indicate fear. The correct answer is A. Conduct a detailed ethogram of Mittens and Whiskers' interactions, documenting the context, frequency, and specific nature of all communication signals, including vocalizations and body language, to understand the underlying social dynamics before recommending any intervention. Explanation. This scenario presents a professional challenge because it requires balancing the immediate welfare of an animal with the long-term implications of intervention, all while adhering to ethical guidelines and professional standards for animal behavior consultants. The core dilemma lies in interpreting and responding to subtle communication signals in a social species where misinterpretation can lead to unintended consequences for the animal's social dynamics and well-being. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the animal's communication methods within its social context. This involves careful observation, data collection, and a nuanced understanding of species-specific behaviors. It aligns with the ethical imperative to act in the best interest of the animal, avoiding anthropomorphism and ensuring interventions are scientifically sound and minimally invasive. Professional standards dictate that behavior consultants should rely on objective data and established behavioral principles rather than assumptions or anecdotal evidence. An incorrect approach that involves immediate, forceful intervention based on a single observed behavior without understanding the broader social context or the specific communicative function of that behavior fails to meet professional standards. Such an approach risks misinterpreting the animal's intent, potentially exacerbating the situation or causing distress. It also violates the principle of least harm, as it bypasses a more considered and less intrusive course of action. Another incorrect approach might be to ignore the behavior, assuming it will resolve on its own. This is ethically problematic as it neglects a potential sign of distress or a developing behavioral issue, failing the duty of care owed to the animal. A third incorrect approach could be to apply a generalized training technique without considering the species-specific communication nuances, which could be ineffective or even detrimental to the animal's social integration and communication repertoire. Professionals should approach such situations by first conducting a comprehensive behavioral history and environmental assessment. This is followed by systematic, objective observation of the animal's interactions and communication signals within its social group. Data should be collected on the frequency, duration, and context of specific behaviors. Interpretation of these signals must be grounded in ethological principles and species-specific knowledge. Interventions should be developed collaboratively with the owner, based on the gathered evidence, and should be designed to be gradual, humane, and to enhance the animal's natural communication abilities and social integration. Regular reevaluation of the animal's progress and adjustment of the intervention plan are crucial components of ethical and effective practice. Question 15. When evaluating a young canine's tendency to mouth objects and people during play, which of the following approaches best reflects an understanding of developmental stages in animal behavior and adheres to best professional practices for a certified animal behavior consultant? Option A. Recognizing that mouthing is a normal exploratory and play behavior during puppyhood, and recommending appropriate redirection and management strategies to teach bite inhibition, while monitoring for any signs of excessive force or aggression that might indicate a deviation from typical development. Option B. Immediately advising the owner to use aversive techniques to suppress all mouthing behavior, as it is a clear sign of future aggression that must be eradicated as early as possible. Option C. Assuming that the mouthing behavior is a direct reflection of the owner's training deficiencies, and recommending a complete overhaul of their household rules without considering the animal's developmental phase. Option D. Applying general principles of juvenile mammal development without specific consideration for canine-specific socialization periods or the nuances of puppy play, and recommending a generic stop biting command. The correct answer is A. Recognizing that mouthing is a normal exploratory and play behavior during puppyhood, and recommending appropriate redirection and management strategies to teach bite inhibition, while monitoring for any signs of excessive force or aggression that might indicate a deviation from typical development. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified animal behavior consultant, CAP, to differentiate between normal developmental variations and potential behavioral issues that may require intervention. Misinterpreting developmental stages can lead to either unnecessary stress for the animal and owner due to overintervention, or a failure to address a genuine problem, potentially exacerbating it and impacting the animal's welfare and the human-animal bond. The CAB must possess a nuanced understanding of species-specific developmental timelines and the factors that can influence them. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the animal's species, breed, age, and individual history, comparing observed behaviors against established developmental milestones for that specific species and age group. This aligns with the ethical and professional standards expected of a CAB, which mandate evidence-based practice and a commitment to animal welfare. By grounding the assessment in established scientific literature and developmental psychology principles, the CAB ensures that their recommendations are appropriate, effective, and minimize risk to the animal. This approach prioritizes the animal's well-being by accurately identifying whether behaviors are transient developmental phases or indicative of underlying issues requiring targeted intervention. Incorrect approaches analysis. One incorrect approach would be to immediately label any observed deviation from typical adult behavior as problematic and requiring immediate correction. This fails to acknowledge the transient nature of many behaviors during developmental stages, such as exploration, social learning, and hormonal changes, which are normal and adaptive. Such an approach could lead to the application of inappropriate or aversive training methods that could suppress natural behaviors, cause fear or anxiety, and damage the human-animal bond, potentially creating new behavioral problems. This violates the principle of do no harm and the requirement for evidence-based practice. Another incorrect approach would be to rely solely on anecdotal evidence or popular opinion regarding animal behavior without consulting scientific literature or considering the specific context of the animal. This can lead to misdiagnosis and ineffective or even harmful interventions. For example, assuming a puppy's mouthing is purely a sign of aggression without considering its role in play and exploration during teething would be a significant error. This approach lacks the rigor expected of a CAPC and can result in recommendations that are not only ineffective, but also detrimental to the animal's development and welfare. A third incorrect approach would be to generalize developmental stages across different species without accounting for significant variations. While some broad principles of development may apply, the specific timing and manifestation of behaviors, such as socialization windows, sexual maturity, and cognitive development, differ vastly between, for example, a dog, a cat, or a bird. Applying a canine developmental timeline to a feline case, or vice versa, would lead to inaccurate assessments and inappropriate recommendations, failing to meet the professional standard of species-specific expertise. Professional reasoning. Professionals should adopt a systematic and evidence-based approach. This involves 1. Gathering a thorough history from the owner, including details about the animal's environment, diet, social interactions, and any observed behaviors. 2. Conducting direct observation of the animal in its typical environment, if possible. 3. Consulting peer-reviewed scientific literature and established developmental models for the specific species and breed. 4. Differentiating between normal developmental behaviors and those that indicate a welfare concern or require intervention. And 5. Developing a behavior modification plan that is tailored to the individual animal's needs, developmental stage, and the owner's capabilities, always prioritizing the animal's welfare and the human-animal bond. Question 16. Process analysis reveals that a client is seeking assistance for their dog's stubbornness and disobedience, attributing these traits to the dog knowing it's being bad and trying to get back at them. The client expresses frustration, stating, "He just doesn't listen when I tell him to stop. It's like he's doing it on purpose to annoy me." As a certified animal behavior consultant, how should you define and scope the animal's behavior in response to this client's concerns? Option A. Explain that stubbornness and disobedience are anthropomorphic interpretations and that the dog's actions are likely driven by underlying motivations such as lack of understanding, competing reinforcement, or environmental triggers, which require objective assessment to identify and address. Option B. Reassure the client that their interpretation is likely correct and that the dog's emotional state is similar to human feelings of spite, focusing on the dog's perceived intent to annoy. Option C. Agree with the client's assessment that the dog is intentionally being disobedient and suggest punitive measures to correct the bad behavior and assert dominance. Option D. Immediately dismiss the client's observations as irrelevant and proceed with a generic training plan without further discussion of the dog's specific behaviors or motivations. The correct answer is A. Explain that stubbornness and disobedience are anthropomorphic interpretations and that the dog's actions are likely driven by underlying motivations such as lack of understanding, competing reinforcement, or environmental triggers, which require objective assessment to identify and address. Explanation. Scenario analysis. This scenario presents a common challenge for certified animal behavior consultants, CAPC, where a client's interpretation of their pet's behavior may be influenced by anthropomorphism and anecdotal evidence, rather than objective behavioral science. The professional challenge lies in bridging this gap, ensuring the client understands the scientific definition and scope of animal behavior while respecting their emotional connection to their pet. Misinterpreting or oversimplifying the behavior can lead to ineffective interventions, potential harm to the animal, and a breakdown of the professional relationship. Correct approach analysis. The correct approach aligns with the core principles of the Certified Animal Behavior Consultant (CAPC) profession, which emphasizes evidence-based practice and a scientific understanding of behavior. This approach prioritizes objective observation, data collection, and the application of established behavioral principles. It acknowledges that animal behavior is a complex interplay of genetics, environment, and learning, and that attributing human emotions or intentions without scientific basis is inappropriate. This aligns with ethical guidelines that mandate competence, integrity, and the welfare of the animal as paramount. By focusing on observable actions and their environmental or internal triggers, the CAPC ensures that interventions are targeted, effective, and ethically sound, adhering to the scope of practice defined by the profession. Incorrect approaches analysis. One incorrect approach fails to differentiate between subjective interpretation and objective behavioral analysis. This can lead to the CAPC adopting the client's anthropomorphic view, which is not grounded in scientific understanding of animal behavior. This violates the professional obligation to provide evidence-based guidance and can result in misdiagnosis and inappropriate treatment plans, potentially compromising animal welfare. It also fails to educate the client on the scientific scope of animal behavior. Another incorrect approach might involve dismissing the client's observations entirely without attempting to understand their perspective or translate it into behavioral terms. While anthropomorphism is to be avoided, a complete disregard for the client's input can damage the therapeutic alliance and lead to noncompliance with recommendations. This approach lacks empathy and fails to acknowledge the client's role in the animal's life, which is crucial for successful behavior modification. Ethically, it demonstrates a lack of respect for the client. A third incorrect approach could be to offer a diagnosis or intervention based solely on the client's description without conducting a thorough assessment. This bypasses the critical step of objective data collection and analysis, which is fundamental to defining and understanding animal behavior within its proper scope. It risks misinterpreting the behavior, leading to ineffective or even harmful interventions, and is a direct contravention of professional standards that require comprehensive evaluation. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and observations, acknowledging their emotional investment. Then, they must gently guide the conversation towards objective descriptions of the animal's actions, body language, and the context in which these behaviors occur. The CAP should explain the scientific definition of behavior, emphasizing observable actions and their underlying causes, e.g., instinct, learning, environmental factors, rather than inferred human emotions. This involves educating the client about the scope of animal behavior as a field of study, distinct from human psychology or anecdotal interpretations. The professional should then propose a structured assessment plan that includes direct observation, data collection, e.g., behavior logs, and potentially environmental analysis to form an evidence-based understanding of the behavior before recommending any interventions. Question 17. The monitoring system demonstrates a consistent pattern of a dog exhibiting destructive chewing only when left alone for extended periods, with the owner reporting high levels of anxiety and distress in the dog upon their return. The owner is requesting immediate advice on how to stop the chewing before their upcoming vacation. Option A. Provide a list of potential causes for destructive chewing, including boredom and lack of exercise, and instruct the owner to increase the dog's daily exercise and mental stimulation significantly before their vacation. Option B. Recommend immediate implementation of a desensitization and counter-conditioning protocol for separation anxiety, alongside providing a variety of safe and engaging chew toys, while explaining that a full behavioral assessment will be conducted upon the owner's return to refine the plan. Option C. Suggests that the owner immediately administer over-the-counter calming supplements to the dog and to only leave the dog with a single, specific type of chew toy that has been previously successful. Option D. Advise the owner to confine the dog to a crate for the entire duration of their absence, as this is a common and effective method for preventing destructive behavior. The correct answer is B. Recommend immediate implementation of a desensitization and counter-conditioning protocol for separation anxiety, alongside providing a variety of safe and engaging chew toys, while explaining that a full behavioral assessment will be conducted upon the owner's return to refine the plan. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's perceived urgency and the ethical imperative to conduct a thorough and unbiased behavioral assessment. The client's emotional investment in their pet's welfare, coupled with their desire for a quick resolution, can create pressure to provide immediate, potentially superficial, answers. However, a certified animal behavior consultant, CAPC, is bound by ethical guidelines that prioritize the animal's well-being and the integrity of the assessment process. This requires a commitment to data collection, objective observation, and a systematic approach, even when faced with client impatience. The correct approach represents best professional practice because it adheres to the core ethical principles of animal behavior consulting, specifically those related to responsible assessment and client communication. By prioritizing a comprehensive assessment that considers multiple contributing factors, the CAP demonstrates a commitment to understanding the root causes of the behavior, rather than merely addressing surface-level symptoms. This aligns with the ethical obligation to avoid making premature diagnoses or recommendations that could be ineffective or even detrimental to the animal. Furthermore, transparent communication about the assessment process, including its limitations and the time required for accurate evaluation, manages client expectations and fosters trust, which is crucial for successful behavior modification. This approach upholds the professional standard of providing evidence-based and ethically sound advice. An incorrect approach that focuses solely on immediate symptom management without a thorough assessment fails to uphold the ethical duty of care. It risks misdiagnosing the problem, leading to ineffective or even harmful interventions. This could violate ethical guidelines that prohibit practicing outside one's scope of competence or providing advice without sufficient information. Another incorrect approach, such as solely relying on the client's subjective interpretation of the behavior without independent observation, introduces bias and compromises the objectivity of the assessment. This directly contravenes the ethical requirement for objective data collection and analysis. Finally, an approach that dismisses the client's concerns or pressures them into a specific, unverified solution is ethically unsound, as it fails to respect the client's autonomy and can damage the professional relationship. The professional decision-making process for similar situations involves a structured approach. First, actively listen to and acknowledge the client's concerns to build rapport. Second, clearly articulate the necessity of a comprehensive assessment process, explaining the rationale behind each step and managing expectations regarding timelines. Third, gather all available information, including detailed history from the client, but critically evaluate it against objective observations. Fourth, conduct direct observations of the animal and its environment to gather unbiased data. Fifth, analyze the collected data to identify potential contributing factors and formulate a differential diagnosis. Finally, develop and communicate a clear, evidence-based plan, ensuring the client understands the proposed interventions and their rationale. Question 18. Upon reviewing video footage of a capuchin monkey in a sanctuary setting, you observe it repeatedly attempting to access a piece of fruit placed inside a transparent, narrow-necked tube. The monkey exhibits frustration, vocalizing and pawing at the tube, but has not yet discovered how to use any available objects in its enclosure to extract the fruit. What is the most ethically and scientifically sound approach to facilitate the monkey's problem-solving and potential tool use in this situation? Option A. Immediately introduce a stick or other suitable object into the enclosure, placing it near the tube, to prompt the monkey towards a potential tool-use solution. Option B. Observe the monkey's continued attempts to problem-solve without intervention, allowing it to discover a solution independently or to abandon the task if it becomes too frustrating. Option C. Provide the monkey with a variety of novel objects that are not directly related to the current task, hoping it will engage with them and potentially discover their utility. Option D. Modify the enclosure by widening the neck of the tube to make the fruit more accessible, thereby reducing the monkey's frustration. Correct answer is B. Observe the monkey's continued attempts to problem-solve without intervention, allowing it to discover a solution independently or to abandon the task if it becomes too frustrating. Explanation. This scenario presents a professional challenge because it requires balancing the desire to observe and understand an animal's natural problem-solving behaviors with the ethical obligation to ensure the animal's welfare and avoid unnecessary stress or harm. The consultant must consider the potential impact of their intervention on the animal's behavior, its environment, and the validity of the data being collected. Careful judgment is required to determine the most appropriate course of action that aligns with professional ethics and best practices in animal behavior consulting. The correct approach represents best professional practice because it prioritizes the animal's welfare by seeking to understand the behavior in its natural context without direct manipulation that could induce stress or alter the natural problem-solving process. This aligns with ethical guidelines that emphasize minimizing harm and respecting the animal's autonomy. By observing the animal's spontaneous attempts to access the food, the consultant can gather more ecologically valid data on its inherent problem-solving abilities and tool-use repertoire. This approach also demonstrates a commitment to scientific integrity by avoiding artificial influences on the behavior being studied. An incorrect approach that involves immediately providing a tool or altering the enclosure to make access easier would be professionally unacceptable. This would represent an ethical failure by potentially interfering with the natural expression of the animal's problem-solving skills, and could lead to a misinterpretation of its capabilities. It also fails to adhere to the principle of minimal intervention, which is a cornerstone of ethical animal behavior consulting. Furthermore, such an action could be considered a failure to respect the animal's natural behavioral repertoire, potentially leading to learned helplessness or dependence. Another incorrect approach, such as introducing a novel, complex tool without prior observation or assessment of the animal's readiness or potential for frustration, could also be ethically problematic. This might lead to undue stress, anxiety, or a negative association with problem-solving tasks. It fails to consider the individual animal's learning history and current emotional state, which are critical factors in designing effective and ethical behavioral interventions or observations. The professional decision-making process for similar situations should involve a thorough assessment of the animal's current state, its environment, and the specific behavioral question being investigated. It should begin with non-invasive observation to gather baseline data. If intervention is deemed necessary, it should be gradual, systematic, and always prioritize the animal's welfare. The consultant should consider the potential for frustration, stress, and the impact on the validity of the data. Ethical guidelines and established best practices in animal behavior science should guide every step of the process. Question 19. During the evaluation of a complex canine aggression case, a certified animal behavior consultant, CAP, is reviewing the client's history and considering various theoretical frameworks to inform their assessment and intervention plan. Which of the following approaches best reflects a responsible integration of historical perspectives within current professional practice? Option A. Emphasizing early instinctual theories of aggression, such as dominance hierarchies, as the primary explanation for the behavior, without significant consideration for modern behavioral science or environmental factors. Option B. Prioritizing foundational ethological concepts and early learning theories, while critically evaluating their relevance and applicability in light of contemporary research and ethical guidelines for animal welfare. Option C. Disregarding all historical perspectives in animal behavior studies, believing them to be outdated and irrelevant to modern, evidence-based consulting practices. Option D. Focusing exclusively on anthropomorphic interpretations of the dog's emotional state, attributing human-like motivations to the behavior without grounding the assessment in observable data or scientific principles. The correct answer is B. Prioritizing foundational ethological concepts and early learning theories, while critically evaluating their relevance and applicability in light of contemporary research and ethical guidelines for animal welfare. Explanation. This scenario presents a professional challenge because a certified animal behavior consultant, CAP, must integrate historical perspectives into their practice without compromising current ethical standards or scientific validity. The challenge lies in discerning which historical theories remain relevant and scientifically supported, and which have been superseded by modern research, while also considering the ethical implications of applying outdated or potentially harmful practices. Careful judgment is required to ensure that historical context informs, rather than dictates, current best practices. The correct approach represents best professional practice because it acknowledges the evolution of the field of animal behavior. By referencing foundational ethological concepts and early learning theories, it demonstrates an understanding of how current methodologies and ethical considerations have developed. This approach prioritizes evidence-based practices and contemporary ethical guidelines, ensuring that interventions are humane, effective, and aligned with the CAP professional responsibilities. It reflects a commitment to continuous learning and the application of the most current and scientifically validated knowledge. An incorrect approach that relies solely on early instinctual theories without considering modern behavioral science principles fails to meet current professional standards. Such an approach may lead to misinterpretations of behavior and the implementation of ineffective or even detrimental interventions, potentially violating ethical guidelines that mandate evidence-based and humane treatment. Another incorrect approach that prioritizes anthropomorphic interpretations over observable behavior and scientific data is also professionally unacceptable. This can lead to inaccurate assessments and inappropriate recommendations, as it disregards the scientific rigor expected of a CAP and may result in interventions that do not address the actual underlying causes of the behavior. A further incorrect approach that dismisses all historical perspectives as irrelevant overlooks the foundational contributions that have shaped the field. While outdated theories may be superseded, understanding their historical context can provide valuable insights into the development of current understanding and ethical frameworks. Ignoring this entirely can lead to a less nuanced and comprehensive understanding of animal behavior. The professional decision-making process for similar situations should involve a critical evaluation of historical theories against current scientific literature and ethical guidelines. Professionals should ask, is this historical concept supported by contemporary research? Does applying this concept align with current ethical standards for animal welfare? What are the potential benefits and risks of incorporating this historical perspective into my current practice? This iterative process of critical appraisal ensures that historical knowledge is used judiciously to enhance, not compromise, professional practice. Question 20. Quality control measures reveal that a certified animal behavior consultant has consistently utilized a specific standardized behavioral assessment for all canine clients, regardless of breed, age, or presenting problem. This approach has led to some clients questioning the relevance of the assessment results to their dog's specific issues. Which of the following represents the most professionally sound and ethically compliant approach to utilizing standardized behavioral assessments? Option A. Disregarding the standardized assessment entirely and relying only on informal interviews with the owner and general observations. Option B. Supplementing the standardized assessment with direct observation of the animal in its home environment and gathering detailed owner-reported history to contextualize the assessment's findings. Option C. Relying solely on the standardized assessment, assuming its broad applicability across all canine populations and behavioral issues. Option D. Modifying the standardized assessment protocol to include questions more relevant to the specific breed or presenting problem, as determined by the consultant. The correct answer is B. Supplementing the standardized assessment with direct observation of the animal in its home environment and gathering detailed owner-reported history to contextualize the assessment's findings. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting, ensuring the reliability and validity of assessment tools when faced with potential biases or limitations. The challenge lies in balancing the need for standardized, objective data with the inherent variability of individual animals and their environments. A consultant must critically evaluate the suitability of a chosen assessment for a specific case, considering factors like the animal's species, breed, age, history, and the context in which the assessment is administered. Failure to do so can lead to misdiagnosis, ineffective intervention plans, and potential harm to the animal or its human caregivers. Correct approach analysis. The correct approach involves a thorough understanding of the chosen standardized behavioral assessment's psychometric properties, including its validation for the target species and population, its sensitivity to environmental factors, and its known limitations. A best practice is to supplement the standardized assessment with observational data gathered in the animal's natural environment and through consultation with the owner regarding their observation. This multifaceted approach ensures that the assessment's findings are contextualized and interpreted within the broader picture of the animal's behavior, aligning with ethical guidelines that prioritize the animal's welfare and the provision of evidence-based services. This aligns with the principles of responsible practice, emphasizing the need for scientifically sound methods and a holistic understanding of the animal. Incorrect approaches analysis. One incorrect approach involves solely relying on the standardized assessment without considering the animal's individual circumstances or the environmental context. This fails to acknowledge the limitations of any single assessment tool and can lead to misinterpretations. Ethically, this approach risks providing an incomplete or inaccurate behavioral profile, potentially leading to inappropriate recommendations and compromising the animal's welfare. It also disregards the professional obligation to gather comprehensive data. Another incorrect approach is to modify the standardized assessment protocol to fit the consultant's preconceived notions or the owner's desires, rather than adhering to the established methodology. This compromises the standardization and validity of the assessment, rendering its results unreliable and incomparable to normative data. This is a direct violation of professional integrity and can lead to misdiagnosis and ineffective treatment plans, potentially causing harm. A third incorrect approach is to dismiss the standardized assessment entirely in favor of purely anecdotal observations without any structured framework. While anecdotal information is valuable, it lacks the objectivity and systematic data collection that standardized assessments provide. This approach risks subjective bias and can lead to an incomplete understanding of the behavioral issues, failing to meet the professional standard of using evidence-based tools. Professional reasoning. Professionals should approach standardized behavioral assessments with a critical and informed perspective. The decision-making process involves 1. Selecting an assessment tool that is validated for the specific species, breed, and age group. 2. Understanding the assessment's methodology, scoring, and interpretation guidelines. 3. Considering the potential impact of the testing environment and the animal's current state on the results. 4. Supplementing the standardized assessment with other relevant data, such as owner reports and direct observation in naturalistic settings. And 5. Interpreting the findings within the context of the individual animal's history and environment, always prioritizing the animal's welfare and the scientific integrity of the assessment.